What is recovery like after ptosis surgery?
At one level, the recovery after ptosis surgery is related to the type of ptosis surgery as well as the medical status of the person who's recovering from the surgery. At another level, a person's recovery can be affected by their experience in the operating room as well as in the recovery area. It has been my assertion that the patient's experience during and immediately after surgery has an impact on the short-term recovery as well as the long-term recovery period. The factors which I have been successful in helping my patients recover after surgery include the anesthesia method, the surgical team, the surgical technique, and the post-operative recovery process. In our practice, we help our patients recover faster by performing the surgery under local anesthesia with intravenous or IV sedation. We rarely use general anesthesia, which is usually associated with longer recovery and in my experience is also associated with more bruising and swelling. In addition, we avoid any sedation which can cause nausea or grogginess afterwards. In fact, we have developed our own customized approach to sedation, which consistently results in our patients waking up fresh and comfortable, allowing them to go home soon after surgery. I've performed surgery at numerous hospitals and surgery centers and have had variable levels of assistance at those institutions. When assistants and other medical personnel work with many different surgeons, it's difficult to perform any procedure smoothly and efficiently. Longer surgery times can have an impact on recovery. Recognizing this as a challenge for my patients, I perform my procedures in my own operating facilities which are accredited by the Joint Commission. The Joint Commission is the same organization which oversees hospitals and ambulatory surgery centers. I can state without any reservation that working with my own team in my own facilities has resulted in our patients having a much better recovery experience. In my opinion, for optimal cosmetic and reconstructive surgery, the surgeon should have an intrinsically artistic eye, technical proficiency, and a lot of experience. During my consultations, I discussed how I feel that as a surgeon with over 20 years experience, I'm able to handle many different situations in a way an experienced pilot can handle different situations when flying a plane. Generally, a well-executed surgical procedure will typically result in a better recovery experience. Before I designed my own surgical facilities, I performed surgery at hospitals and surgery centers where I was frustrated by my patients' experience in the recovery area. Unfortunately, I found that there was always a mismatch between the number of patients in the recovery room and the number of people available to take care of them. This resulted in delay in proper care for procedures such as eyelid surgery, where ice or cold compresses need to be applied as soon as possible. In addition, the patients did not receive the one-to-one attentive care that I feel is appropriate for optimal recovery. In my facilities, we have systems and people to attend to our patients immediately upon the completion of surgery, which has helped my patients recover faster. As far as the home recovery process is concerned, it is typical to have some swelling and some bruising, particularly in the first 24 to 48 hours. We see this improve daily, such that most of our patients are able to return to work in 5 to 7 days after surgery. Some application of cover-up makeup or wearing tinted eyewear can be helpful at that time. A significant part of the healing process occurs during the first few months. Healing can go on for approximately 1 year after any type of surgery.